workforce. The panel is taking place as part of the Healthy Students Promising Future Learning Collaborative meeting, which Healthy Schools Campaign leads to support states and school districts in expanding Medicaid-funded school health services. We have 15 state teams participating in the Learning Collaborative, as well as over 20 national organizations. And we just heard about the incredible work that they are leading to support the health and wellness of students across the country. This panel marks the launch of our 2021 Change for Good forums, a series of dynamic virtual events that bring together policymakers and leaders from the health, education, environment, civic, and grassroots communities to discuss how to ensure the health and success of all students. The Change for Good forums are part of our ambitious call to further integrate health and equity into national education policy and practice. This calls for providing students with supportive learning conditions with a focus on expanding health services, expanding access to healthy, nutritious school meals, and investing in healthy and climate resilient school campuses. Today, we will focus on how we can ensure health equity in COVID-19 health and education policy. This is a topic that is more important than ever as we consider the impact of COVID-19 on disparities in health and education. We know that children of color and children from low-income families are more likely to test positive for COVID-19, and that children of color are disproportionately impacted by severe COVID-19 and related illnesses. Children of color have also disproportionately felt the educational effects of the pandemic. While these disparities were made worse by the pandemic, they are not new. Our panelists today will speak to these disparities and how equity can drive decision-making at the federal and state levels. We will hear from Dr. Choucair about the national COVID-19 vaccination effort and the role that health equity is playing in shaping the nation's response to vaccine distribution. Then we will hear from Mayra Alvarez about the health disparities related to the pandemic and the role that states can play in improving health, in improving equity in health and education. Our first speaker is Dr. Choucair. As the White House COVID-19 vaccination coordinator, Dr. Choucair is responsible for overseeing the national vaccination efforts under the Biden-Harris administration. Prior to joining the administration, Dr. Choucair served as Senior Vice President and Chief Health Officer at Kaiser Permanente, where he oversaw the organization's efforts focused on addressing the social determinants of its members and communities served. And prior to that, Dr. Choucair was the Commissioner of the Chicago Department of Public Health and Senior Vice President of Safety Net and Community Health at Trinity Health. Dr. Choucair, thank you so much for joining us today. The virtual floor is now yours.
Great, thank you so much, Rochelle, and it's great to be with you all. It's always wonderful to be with the folks who've been working on the Healthy Schools campaign. I've worked with the Healthy School campaigns from my days in Chicago as health commissioner, and to be speaking to the group that's focusing on equity, focusing on ensuring health and safety of our next generation and supporting all those who are experiencing health and education inequities is so critical. So thank you so much for giving me the opportunity to join you today. I thought what I'll do is I'll spend just some time highlighting some of our efforts on executing our national vaccination strategy with a big focus on equity. I'll talk a little bit about how our strategy is evolving, and particularly what is it that we're doing specifically to ensure that we're getting vaccine to our adolescents and ensuring that schools are up and running. So let me start with the vaccination program. When we came into office, we have two key priorities when it comes to vaccinations. We wanted to get as many shots as possible and as quickly as possible, but more importantly, as equitably as possible into people's arms. And to pursue those priorities on the vaccination fronts, our vaccination strategies was really about three things. We wanted to increase supply. of the vaccine. We wanted to make more vaccinators available, and we wanted to create more places for people to get vaccinated. So I'll just give you quick updates on where we are on all these three fronts. And I'll start with supply. Obviously, this was the number one issue when we launched our vaccination campaign. In late January, we were making about 8.6 million doses of the vaccine available per week. Today, we're at about 28 million doses of vaccine available every week. So that's more than 3 times the amount of vaccine that was made available weekly. And by the end of this month, we will have enough vaccines for all adults who want to get vaccinated in this country. So lots of good progress on vaccine supply. Didn't come easy, but I'm really pleased with where we are when it comes to supply. If I want to spend just a minute on vaccinators, one of the stream of work that we focused on is making sure that retired doctors, retired nurses will be able to vaccinate. We also worked on making sure pharmacists, dentists, senior medical students, and other medical professionals can give shots. We've also deployed more than 9,100 federal personnel supporting vaccinations across the country, including 5,100 active duty military. And we've also funded more than 2,300 National Guard members currently serving as vaccinators across the country. So a lot of work to make sure we have workforce, we have the people to be able to give vaccinations, but also run community vaccination centers. Now, the third part of the strategy was really focused on creating more places for people to get their shots. And over the last 100 and some days, we've provided more than $4.8 billion to 58 states, tribes, and territories to support and increase vaccination efforts. We've also provided federal support to over 900 community vaccination centers across the country. And FEMA stood up 39 high-volume, federally run vaccination sites to date that have already administered more than 5 million shots in America's most disadvantaged neighborhoods. We've also partnered with the retail pharmacy programs, and we've partnered with actually 21 pharmacy companies, now including over 38,000 activated stores, and over 40% of these stores are receiving doses are located in high-risk zip codes. So the pharmacy program was an integral effort in making sure that there are more places for people to get vaccinated. But we've also wanted to make sure that we're reaching people who are mostly disproportionately impacted by the pandemic. So we've launched a program to provide vaccines directly to community health centers across the country. As you know, there are about 1,400 or so community health centers across the country. They serve 60% of the people who they serve are living at or below the federal poverty level. 2/3 of their patients are people of color. So we wanted to make sure from day one that we're actively engaging with providing vaccine access directly to community health center to be able to support reaching those particular communities. We've also provided federal support to thousands of mobile vaccination pop-up clinics across the country to make access to the vaccine easier. And that was done through community health centers, through FEMA, through the VA, as well as our pharmacy programs. Now, when you think about how far we've gone, we've hit several milestones. Many of those milestones wouldn't have been even imaginable just a few weeks ago. Today in this country, every person 12 years old and up is now eligible for vaccination everywhere in this country. And 90% of people in this country have a vaccine site within 5 miles of where they live. And when you look at our data, just as of today, more than 274 million shots have been administered. Just think about that for a second, 274 million shots. More than 158 million people in this country have gotten at least one shot, including 123 million people who are fully vaccinated. And when you look at people 65 and older, and as you know, 80% of the deaths from COVID-19 was in people who are 65 and older. Today, 84% of seniors in this country have gotten at least one shot, and more than 72% are fully vaccinated. And when you look at deaths in this population, they're down 80%. When you look at hospitalization for seniors in this country, down 70%. So that's the type of effort that makes me so proud of how this country came together to respond to this challenge and respond to this pandemic. Now, this is great progress, but yet we still have a large number of people who need to be vaccinated and who want to be vaccinated. And this requires all of us to work even harder as we get to this next phase of the campaign. And as you know, a few weeks ago, the president set a new goal for this next phase of the vaccination program. 70% of adults in this country with at least one shot and 160 million people fully vaccinated by July 4th. And to meet that president goal, we are in all out implementation and execution mode in three key areas. One, how do we make sure that we're continuing to make vaccine access easier and more convenient? Two, how do we continue to build vaccine confidence? And three, how do we make sure that we're doing all of this with equity at the center of our work? So let me start a little bit on the work that we're doing to improving access and make it even easier for everyone to get vaccinated. Last week, you might have heard Uber and Lyft are planning to offer free rides to anyone going to or from a vaccination site to get vaccinated between May 24th and July 4th. We also announced that we will be partnering with our federal retail pharmacy partners to support on-campus vaccination clinics at some of the nation's largest community colleges in May and June. And these steps build on additional efforts that we've put in place, things like making no appointment walk-in vaccinations available at the vast majority of our local pharmacies participating in the federal pharmacy program. We've also launched 2 new tools to help people get vaccinated. So anyone could text their zip code to 438829 or GetVax, GETVAX, and they get texted back with 3 vaccine sites near them. And we've also launched vaccines.gov to find sites to get more information on where you can get vaccinated. So that's on making it easier and easier for people to get vaccinated. The second piece that we needed to focus on, and we're continuing to focus on, is building vaccine confidence. A couple of weeks ago, FEMA announced that it's making resources immediately available to states to fund on-the-ground vaccine education and outreach effort, including personnel costs. So now states could tap into the FEMA disaster relief funding for things like phone banking, door-to-door canvassing, and pop-up vaccination sites and workplaces and houses and worship. We've also launched the Community Corps, or the COVID-19 Community Corps program, and now we have thousands and thousands of individuals and organizations that are committed to be those trusted messengers in the communities where people live. Community Corps members will receive material from the CDC, frequently asked questions, facts, sample tweets or social media posts and other to help arm these folks with the answers that they need so that they can engage in their communities with conversations with people who might have still questions about the vaccine. And finally, I do want to spend a moment on equity. A number of important efforts on this front are underway. We are committing to doubling down on our strategy around mobile pop-up sites because we know this is an important strategy to help us reach those who are disproportionately impacted by the pandemic. We've made federal investments up to $250 million to hire community health workers who live in the communities they serve to increase vaccine access in those communities. We've made $130 million available in funding to national and local organizations to support improved vaccination efforts, and more than $250 million in funding for states and other jurisdictions to help them power their own vaccine confidence efforts in their communities. And this comes on top of over $7 billion to support community health centers across the country. And we've just announced over $7 billion to support public health workforce across this country. So I'll end by just touching a little bit on our work to vaccinating our younger populations. As you know, the FDA expanded its emergency use authorization for the Pfizer vaccine to now include adolescents ages 12 to 15. We have been working and planning for multiple range of scenarios ahead of the FDA decision, and now we're executing on that. And I'm really happy to report that just in less than a week since we've started this effort, we've already vaccinated over 600,000 12 to 15-year-olds in this country just in the last few days since the authorization was approved. So we've been working for weeks to make sure that we have widespread coverage of the Pfizer vaccine so that young people in communities across the country can access the vaccine. Today, more than 15,000 pharmacies are immediately ready to vaccinate adolescents 12 to 15 years old. We've also eliminated the residency requirement in the federal pharmacy program. So if teens are on the move this summer, they could get their first shot in one state and they can get their second shot somewhere else. And we're also working with hundreds of community and school-based health centers to expand access to on or near campus vaccinations even further over the coming weeks. And we are encouraging schools to work with the community and school-based health centers to conduct pop-up clinics. And then also we're working with doctors, pediatricians, and family docs to make sure that they are enrolled in administering vaccines in their offices to make it easy for people to get vaccinated. And that's why we encourage all of our docs to be able to sign up for this program and be able to administer vaccines in their practices. Which brings me to the final point, which is around building vaccine confidence among teens and their parents. And to do that, we are working closely with medical experts, the American Academy of Pediatricians, the American Academy of Family Physicians. We're also engaging leaders in the education space, including the National Parent Teacher Association and many more. And we'd like to continue to partner with you on this effort. And of course, a central part of this work will be to engage with teens and their parents directly. So we want to make sure that the medical information about the vaccine, the information that they need to make decisions that keep themselves and their families healthy, is available to them. And we want them to hear that from people they trust, their friends, their family, their neighbors, their doctors, their nurses, about the benefits of the COVID-19 vaccine. So thank you for everything you have done. Thank you for everything you're doing and you will be doing to get us more and more people vaccinated in this country so we can put this pandemic behind us. So with that, I'll turn it over back to Rochelle and I look forward to the Q&A.
Well, thank you so much, Dr. Choucair. And it is now my pleasure to introduce Mayra Alvarez. As I said, she is president of the Children's Partnership, a nonprofit advocacy organization working to advance children health equity. She, in addition to serving as a member of the Biden-Harris COVID-19 Health Equity Task Force, she is a member of the First 5 California Commission. She previously served in the U.S. Department of Health and Human Services during the Obama administration and worked for elected officials at the U.S. Senate and House of Representatives. So lots of different roles and takes on the issues, but I think all around the same goal and purpose. So Mayra, thank you so much for joining us. The virtual floor is now yours.
Thanks so much, Rochelle. I really appreciate the opportunity to join you all today. I too have a long history with the Healthy Schools campaign, beginning from my time when I was with Senator Durbin and had the opportunity to meet with folks from Illinois. And then, I feel like the work has continued here in California with our great partners, Teachers for Healthy Kids, the School-Based Health Alliance, you name it. We are partners in this good fight to try and break down our silos. And I'm grateful for the work that you all are doing and leading and have been doing in order to make things better for our kids across the country. Again, thank you for the opportunity to join you today. I really do appreciate the conversation that we're having because it focuses not on what we can do individually or what the health or education sector or the federal government can do on its own, but what we can do together to strengthen our collective response to COVID and really start to prepare a new normal that centers the needs of our most marginalized children and allows all of our children to have the opportunity to thrive and be part of healthy, equitable communities. I think we share a vision where our communities, where our children are, have the social services, the housing supports, the food, the childcare, and that it's linked to health and mental health services where our kids and families are in the community, our schools, and for our youngest kids, our early learning and childcare centers. I think we share a vision for a new normal where a whole child approach really leads our work and where social, cultural, and linguistic needs of families are prioritized as they are served. So I'm gonna build a little bit on what Dr. Choucair said and really bring us back to the experiences of families today, experiences during a very difficult time that is piled on top of what was already difficult circumstances for millions of families across our state of California, but frankly, across the entire country. So today, as we look to the future for hope, given so much of what Dr. Choucair said, millions of families do continue to face multiple crises. Not only is it the pandemic, but it's also a challenging economy, and it's a continued national reckoning on racial injustice. Nearly all aspects of the lives of our children have really been upended by these multiple crises. Think about it from school and childcare closures. Today, 1 in 4 of our childcare providers remains closed because of the pandemic, to increases in mental health needs, where mental health related emergency room visits for kids went up by 31% last year. There are more kids living in poverty, and there's increasing numbers of our kids going hungry. And across the board, it is Latinx, Black, Pacific Islander, and immigrant families who continue to bear the brunt of the pandemic and its devastating consequences, while also simultaneously shouldering that frontline work that's keeping our country's economy running. And it's families of color with children that are being hit the hardest. As I think many of us have seen in the news and have heard about, across the nation, of the at least 284 children who have died from COVID, they're overwhelmingly Black and brown, representing approximately 65% of these deaths, according to the CDC. In children about 14 years of age and younger, Black children are 2.5 times more likely to die from COVID than white children, and Latinx children are nearly 3 times more likely to die from COVID than white children. And I know that the number of deaths are not high, but the rates and the impact are glaring and say to us who it is that's disproportionately impacted and continues to be disproportionately impacted. According to the American Academy of Pediatrics, we know that over almost 4 million children have tested positive for COVID-19 since the beginning of the pandemic. And there were nearly 49,000 new child cases reported just last week. And that marks the lowest number of new weekly cases since late October. Obviously due to the amazing work that's been happening to educate Americans, to ensure we have public health measures in place, and of course, to launch a robust vaccination campaign. However, while the number of kids contracting COVID is much lower than record highs set at the start of the year, we are seeing that children now account for almost a quarter of new virus cases in states. And it's a statistic that may surprise a lot of us, right? Given that a year ago, children made up about 3% of the total. But it's due to a number of different factors that make logical sense, right? The fact that vaccinations were focused on an older community, that there isn't one available for many of our young kids, that there's different outbreaks related to different settings. There's a lot of factors that go into it. And we know that right now, severe illness due to COVID-19 is incredibly rare among kids. but there are a lot of unanswered questions that we have the opportunity to collect more data on what unanswered questions do we need answers to in order to better prepare for the future. What are the longer term impacts of the pandemic on the kids, including the way in which the coronavirus impacts the physical health of our infected children, but also our emotional and mental health, short-term and long-term. And I want to also keep in mind for all of us the indirect ways in which this virus is harming the well-being of children. And we can start with the 43,000 children who have lost their parents to COVID. And again, this disproportionately impacts children of color. And to consider, when we think about our news articles and what's front and center, we talk a lot about family separation and the horrible history of family separation in our country. And it's important to consider that that separation or the threat of separation continues when we consider that there are many of our children who are separated from their parents because of a deadly virus. COVID-19 losses are resulting not only in children not having their parents, but it's during some of the most challenging times for those families in the first place. Social isolation, lack of resources, economic hardship, so potentially leaving kids without the supports that they actually need. So what do we do about that, and where do we go from here, and what opportunities are available to us in the work that we do together? I think first and foremost, finding ways right now to disrupt oppressive systems and old ways of thinking in order to better serve children, to really question the underlying assumptions that shape our systems that we know have perpetuated inequities for far too long, as well as the policies that they implement. And as we envision that better future, what that new normal could look like, we must reimagine how we invest in our education, our healthcare, and our social systems, and how those systems serve our children and families. I think it's paramount that our nation's policy response to COVID-19 address the historic underinvestment in healthy childhood development for children of color and inequitable distribution of resources that are at the root of disparities across race across the country. We've seen for far too long that our nation's patchwork of policies, the disconnected funding streams, the lack of coordination between agencies and among levels of government, as well as burdensome administrative complexity, these are hindering our country's system from delivering on the promise of child well-being. And we can and we must do better. So as we consider what millions of families struggling today need to support their child well-being, we need opportunities to care for that whole child. Much of the work that you all have led has tried to ensure that schools are based in the community, are grounded in community partnerships and centering families. And that's exactly what we mean when we talk about the whole child. So finding these expanded horizons of learning, right? Expanded days, new programs, finding ways in which we can enrich the lives, enrich the learning opportunities for children in new ways, but also integrating student supports where they are, thinking about the integration of mental health services, thinking about the placement of school-based health centers and the expansion of a model that we know works so well. And then again, really centering that relationship with the family and finding ways in which schools have the necessary resources to be able to do that. Together, it's realizing that shared vision where there is leadership that is grounded in collaboration and inclusive decision-making. It's through these approaches that we can rebuild systems that better serve our kids and families, but also that we limit or eliminate the harms that we know have been plaguing communities of color for far too long, and prioritize the solutions that challenge that status quo, that bring healthcare, social services, legal supports to children and families in their community through trusted partners like schools where they feel safe. Initiatives that really refuse to allow health and social and education to be transactional and recognize that kids are part of families and families are part of communities. And finally, a validation of the brilliance of community leaders, of our parents, of our grandparents, of our caregivers, recognizing that it's those experiences, those personal lived experiences, that is where the power lies, that is where our solutions lie. Like that old quote says, right? Those closest to the problems are closest to the solution. And a final point is really to consider how we can repair the harm that's been done. Not only, what we've seen, prior to this administration and the language that we heard at the federal level but really the centuries of oppression that have really left so many of our communities behind. Inequities in funding for a whole child approach have created a ripple effect where children and families with fewer resources receive fewer opportunities to learn and thrive. And prioritizing investments in these communities will create long-term social and economic benefits. And nowhere is that more apparent than in our response to COVID-19 and how we build back better for our families across the country. These have been incredibly difficult times for so many people, especially those directly impacted by the ongoing trauma associated with COVID, the economy, and racial injustice. So this is the time to come out wiser, more reflective, and more united in our will to disrupt systemic racism and double down on that commitment to the health and opportunity of every child. And I believe that starts with knowing that we cannot do right by all children in this country until we do right by children of color, Latinx children, Black children, children in immigrant families, and others that have been so disproportionately impacted by today's multiple pandemics on top of those hundreds of years of systemic oppression. It's a once in a generation opportunity to disrupt the health, economic, and racial inequities that fueled this pandemic and devastated so many across the country. And I believe it's the work that you all are leading that really lays the foundation to make that a reality. And I'm looking forward to talking more about how we can do that together. So thank you.
Well, thank you so much, Mayra. There was a lot there that you said that I would love to be able to unpack. And I know that we have about 10 or 12 minutes for some questions. I would love to just start the questions. We did get questions from participants ahead of time, but I'd love to start the questions kind of the same question for each of you, but a little bit different, really to focus in on the role of schools. And Dr. Choucair, to start with you, you did comment a little bit towards the end of your remarks about the role of schools in addressing the vaccination, but I'd like to just try to see if we can go a little further on that and see what, if you have anything else to add really about what either additional thoughts about the topics that you mentioned or additional roles for schools, either, not necessarily getting into federal policy issues, but just, kind of your thoughts about how particularly our Healthy Students Promising Future folks that are on the call should be thinking about this. We're gonna, should school districts be thinking about, or should states be thinking about requiring eligible students to be vaccinated as part of the kind of standard vaccinations? What role can schools really play in educating parents and community members? How do you really see, again, given how political the topic of that, some topics, school food is political, let alone vaccinations. How do you see some of those issues playing out in the school community? And just, as you have thought about the role of school and really harking back to your time in Chicago, where you had a direct role in, the school health program in Chicago, just any additional thoughts or perspective on really what role schools can play in really addressing the vaccination issue in particular, or just this whole issue in general?
Yeah, thank you, Rochelle. So the three things I would point out to. One, I think it's important to know that vaccines are safe, vaccines are effective. We've learned that from the trial data from the Pfizer vaccine. We are expecting data from the Moderna side. We know J&J is also doing some studies on children. So we really need to make sure that we are doing the best we can to encourage adolescents now to get vaccinated, and then down the line, if there are expansion to the age groups, to go that far. And I do think schools will have a big role to play there. Now, on the mandate side, these are obviously local decisions. We won't be commenting on that at this point, but I do think schools will have to play a significant role in making sure that at this point, adolescents are getting the vaccines. And to your point, we are exploring with schools that have school-based health centers on campus to try to figure out how can we support them in making sure that they are either engaged in one way, shape, or form, whether on the education front or on the vaccination front, offering vaccine education or administration to students on campus, which I think would be really important. And we know there are a large cadre of school-based health centers. As you know, I had the opportunity to be part of organizations that have ran those and advocacy groups that been very supportive of school-based health centers. So I do think there's a big role there. The second piece, and I know this was one of the questions also in the chat box, I think it came just to me. I think school nurses are going to have to play a big role in the response to the pandemic overall, but also particularly around vaccine education. And that's why as part of the public health workforce funding that we've made available last week, there's about $500 million that are dedicated to hiring school nurses. And I do think that's going to be an important part of that effort to help us get more people vaccinated and help getting us help putting the pandemic behind us. And then the third thing that I would add, and I would kind of turn it over because I'd love to hear Mayra's perspective on that as well. We will be putting this pandemic behind us. We're seeing significant progress, number of cases going down, hospitalizations going down, deaths going down, but we still have a long way to go. But most importantly, I think as we recover from this pandemic, we'd want to make sure that we're recovering in an equitable way. And we'd want to make sure that people who've been disproportionately impacted by this pandemic are having an opportunity to recover with a lot of support so we can put a lot of the inequities that we've seen behind us. And I have no doubt that schools will play a significant role in that. Schools are such an important assets in our communities. They play an important role. They played an important role during the pandemic, and I have no doubt they'll play an important role as we put this pandemic behind us on issues that matter to a lot of people in this country: food insecurity, housing instability, transportation issues, a lot of challenges that I think we have to be really thoughtful about as we recover. But I really would love to hear Mayra's perspective as well.
Mayra, do you want to?
Sure, I'm happy to share some thoughts. I mean, just building on what Dr. Choucair said, like before the pandemic, survey after survey have told us that schools are trusted resources for our communities, particularly many of our most marginalized communities, that schools are hubs of information, and we need to leverage that in every way possible. And I completely agree about the point with schools with school-based health centers. But even here in California, many of our schools who do not have the opportunity to have a school-based health center yet, they're serving as vaccination sites and are working in partnership with community health centers, other community organizations to serve as family sites for vaccination. And that's something that's particularly important as we roll out the expansion of the vaccine to younger kids, 12 to 15. How do we make this about the family? How do we make it about parents being able to get vaccinated at the same time as their kids? How can the kids encourage their parents to do it, right? And really recognizing that families are units, and it's often not kids themselves that are able to move forward on these activities, but that we have to consider these whole family approaches and how we're recovering from this pandemic. And the only other thing I will say, there's such other services and connections that schools are able to make for families that make responding to the pandemic and building back from the pandemic that much more possible. And I think leveraging the role that schools play in our communities is particularly important. And I'm looking forward to, what that looks like, obviously from the federal government's investments, but also from our state investments as we see the federal dollars trickle down to states in the next few months.
Well, thank you. And Mayra, to follow up with a different question, you talked a lot about the need for a whole child approach. And obviously at Healthy Schools Campaign, we talk a lot about the whole child approach and look for a lot of policies that make it more practical at a school level to do that. And now all of our systems are disruptive and we have an opportunity to put some things back together differently, as you noted. What do you see as the biggest opportunity to do something differently? And what do you see as the biggest threat to doing it right?
Yeah, it's a great question. I think the biggest opportunity is really to leverage our Medicaid program and recognizing that our Medicaid program is not, frankly, the safety net program that is limited to a very small portion of our population. Half of our babies born in this country are born because of Medicaid. Almost 60% of California's 9 million children are part of Medi-Cal, which is our state Medicaid program. Finding ways in which we can leverage Medicaid to be the foundational program that it is for the well-being of our children and families will help sustain many of these changes. We're so encouraged at the level of investment that the American Rescue Plan is going to make into our communities, that the potential for the American Families Plan to do the same. But how do we make those investments sustainable for the long haul? How do we make access to these types of services and supports a fundamental right for our children? And as we all know, the Medicaid program through EPSDT, early periodic screening, diagnosis, and treatment, they are certain rights that our kids have under Medicaid. And how do we make that a reality? So that I think is the greatest opportunity that we have. The greatest barrier is the complexity associated with that. For many schools, the administrative burden that happens as a result of trying to do billing certain ways and trying to figure out reporting, and how can we make sure our systems that are rooted in white supremacy and racism, structural racism, are not actually limiting the very benefits that we want to make sure reach our children, all of our children, but particularly our most marginalized. And I think that is what we're going to have to overcome together, working with the federal government, working with state governments and our CBOs to try and ensure we can make a reality.
Thank you. I think we have time for one question, and it's unfortunately we've had it's a big question, and I'll ask you for a short answer. But a lot of our questions obviously were about really a big concern by our audience of the long-term impact on our children, past the physical impact of COVID and onto the traumatic impact that this has had. And with a real recognition, from the questions that came into me about, recognizing the impact of the trauma on our communities, or children of color. I guess just if you have any last minute thoughts or about where you see solutions to that really big question in a final minute or two. Sorry, really big question. And I realize, Dr. Choucair, a little beyond your role as vaccination, but I'm sure you have some thoughts about that.
I mean, this is such an important topic. This is probably a whole day worth of conversations for all of us. I think it is really important as we recover from this pandemic to think about how we're recovering in an equitable way. And most importantly, also being able to address the trauma and the impact that this pandemic has had on kids across the country, has had on their parents across the country. And if we don't do that, unfortunately, we won't be prepared for the next pandemic. We know that, we're going to continue to have public health crises across ages and generations, and we have to be able to be prepared and building resilience. And that's going to be an important part of that journey. I mean, that's a as short of an answer as can be. Mayra, any thoughts you'd want to add here?
I think the only thing I will add is just even recognizing that it is long-term and that there are no quick fixes, right? That, oh, we've got these couple plans and now we're done and we're going back to a normal. No, this is going to be long-term, and particularly on the development of our young kids, development of our kids across the childhood development spectrum. It's going to take time and resources over the next 10, 15, 20 years to ensure our children recover from this pandemic in the best way possible so that they can be the productive adults we need them to be in society. So I think that recognition in and of itself for our government, for us as advocates, for us as partners in the community, I think is critical. And then the second one is making sure that we focus on meeting families' needs, but that we also focus on meeting our workforce needs and making sure our teachers, our childcare providers, our education professionals are prepared to respond to how our children will show up differently in our classrooms, in our early learning settings. And I think recognizing that, investing in their professional development, their training, incentivizing those opportunities is particularly important as we will rely on them to do even more with less, and really recognizing their important role in raising our kids together.
Well, thank you. And thank you both so much for joining us today. Mayra, I am sure that you are very, very busy, but Dr. Choucair, I can't even imagine what your day looks like. And so, you know, just because it's all over the news and it's constantly changing. And so a special thank you for taking time out of your really busy schedule to join us today. And Mayra, is always a great pleasure to reconnect with you over the years. Both of you have been partners with Healthy Schools Campaign over the years. We so greatly appreciate it. And again, thank you for sharing your thoughts here today. And I'm sure our paths will cross again in the future. And if there's anything we can do to help, please reach out. Thank you.
Thank you so much.
Thank you.
Before we transition back to the Healthy Students Promising Future Learning Collaborative meeting, I want to take a moment to thank our sponsors for our 2021 Change for Good forums. They're listed here. It's their generous support that makes sessions like today possible, and we greatly appreciate their commitment to ensuring the health and success of all students. I'd also like to thank the sponsors of our Healthy Students Promising Future Learning Collaborative and their support of today's Learning Collaborative meeting. At this time, we are going to transition back to our Healthy Students Promising Futures Learning Collaborative meeting. If you've joined us for the Change for Good forum, you're welcome to exit the meeting at this time. Thank you so much for joining us, and stay tuned for future Change for Good invitations. If you're part of the Learning Collaborative, hang in there just a few more minutes. We've just got some logistical announcement about tomorrow's session. So thank you all for a great day today. I'd like to once again thank all of our amazing speakers, moderators, and of course our state team leads for sharing with us throughout the day. And to our Tennessee friends, my daughter went to Vanderbilt and we loved Loveless Cafe. So great choice there. Before we break for the day, a few housekeeping items. We're going to start at the same time tomorrow. So the time depends on what time zone you're in. 1 o'clock Eastern time. And you're going to have to figure out what time that is in your time zone, because I will mess it up. And we are going to go for 2.5 hours again. As a teaser for tomorrow's agenda, we will be hearing from Jessica Schubel, who is the Director of ACA and Health